All right, good morning. Good morning, good morning. Thank you so much for coming out this morning. As treasurer, I have made it a priority of this office to help Rhode Island families access greater economic opportunities, improve self-sufficiency, and save for retirement. Today, I'm proud to launch a program that will bring real relief to thousands of Rhode Islanders currently dealing with the burden of medical debt. No one chooses to go into medical debt. If you or a loved one is sick or injured, you seek care, period. Medical debt can happen to almost anyone in the United States, but this debt is the most pronounced among people who are already struggling with poor health, financial insecurity, or both. Medical debt disproportionately affects uninsured, underinsured, and low-income households. For people and family with limited assets, even a relatively small unexpected medical expense can be unaffordable. High deductibles can contribute to insured individuals receiving medical bills that they are unable to pay. Here in Rhode Island, an estimated 5.2% of adults report having medical debt with an estimated $1,400 in collections per person. These are our friends, our neighbors, and our families. I have heard from folks across the state who are struggling with medical debt. Living with the burden of medical debt can have serious repercussions. The financial constraints brought on by unaffordable medical bills can become barriers for housing and employment and increase the likelihood of bankruptcy and other legal implications like wage garnishment and property seizure. But the impact is just not financial. A recent report from the Consumer Financial Protection Bureau found that medical debt can adversely affect people's physical and mental health as well. Many individuals with medical debt delay or avoid medical care out of concern for costs and can worsen health circumstances. And people with debt are 3 times more likely to suffer from anxiety, stress, and depression. Getting medical treatment shouldn't force families into a lifetime of physical and financial hardship. Thanks to this new program, partners with undue medical debt and funded with $1 million allocation from the General Assembly, we look forward to abolishing medical debt for thousands across our state. This new program is a critical resource to protect Rhode Islanders' finances, dignity, and health. So how will it work? Working with my office, Undue will purchase qualifying medical debt held by healthcare providers and secondary debt collectors. To date, Undue has abolished nearly $15 billion in debt across the country, including Connecticut, Arizona, New Jersey, New York City, and Cook County, Illinois. Rhode Islanders are eligible for relief if their medical debt amounts to 5% or more of their estimated annual income, or if their estimated annual income is below 400% of the federal poverty line. The best part is, Rhode Islanders do not even need to apply. Qualifying accounts will have their debt canceled without any action by the resident. Residents will receive a letter from my office in Undue stating the amount of debt forgiven and the former holder of the debt. Rhode Island's investments through this partnership will help working families advance their physical and financial health so that they can thrive, not just survive. Thank you to the General Assembly for its initiative and for funding this vital program that will undoubtedly help to improve the healthcare system in Rhode Island. In particular, I want to recognize the Senate's leadership on this issue, which was part of their 2024 health package. I realize this issue is part of a larger, complex healthcare system, and I look forward to advocating for systematic changes and working with my colleagues in government to help Rhode Islanders avoid medical debt in the first place. On a final note, I want to thank my team, Rob, Wilder, Ramon, and Undue Medical Debt for their collective efforts in standing up this program just months after it was passed as part of the budget bill in mid-June. My goal was to implement a fast, efficient, and easy process that would provide relief, as soon as possible, and they delivered just that. Now, I want to introduce my colleague and the reason we're here today, Speaker Shekarchi.
Thank you, Treasurer. Good afternoon. Good morning. It still feels like afternoon. But good morning. It's a pleasure to be here, and it's a pleasure to celebrate this great program, this achievement for all of Rhode Islanders. I want to recognize some people who are here today. Obviously, Treasurer Diossa, thank you for your fast implementation of this program. So many times when we institute a new program, it takes months, if not years, before we start to see results. I'm glad that's not the case here. Representative Mary Ann Shawcross, who championed this issue, among many other ones, an unbelievable fighter for what she believes in, and was able to get this great idea incorporated into the budget, Article 6, I believe. And my good friend from the senior senator from Warwick, Mark McKinney. Mark, you equally did a great job in the Senate. I know this was one of your priorities and one of the Senate priorities. I want to thank the Senate President for his initiative on this and making sure that this was incorporated into the budget. There were a lot of great ideas. This is what happens sometimes, and it's part of the process that involved money. And people say, well, I want a bill. The bills that have money go into the budget, and that's exactly what happened in this case. So thank you both. While you technically didn't get a bill, you still won a very important victory for your constituents and for the people of Rhode Island, both of you. So thank you. I want to give a shout out to Eva Stoll from the Policy Director from Undue Medical Debt. Nina Harrison from the Policy Director from the Rhode Island Economic Progress Institute, who we work so well with. Troy Beck, who's also a strong advocate, and Ernie Davis from the Leukemia and Lymphoma Society of America, who also was very instrumental in advocating for this with his advocacy team. For too many Rhode Islanders, we are one medical crisis away from financial ruin. Medical debt can accumulate quickly and become a deterrent to seeking other health care. What has been done here is hopefully will help alleviate that problem. I'm proud the General Assembly included $1 million for this program in the budget for medical debt relief, which will bring results for hundreds of families and enable them to have a clean slate moving forward. With this, I will tell you that this is going to be a challenging year coming up, and I was glad that we made the prioritization of this bill into last year's budget. So we'll continue to meet the needs of Rhode Islanders whenever we can afford them, and this was a great opportunity that it sets an example for that. I would like to introduce my good friend from the city of Warwick, the senior senator, Mark McKinney. And Treasurer Diossa said the reason we're here today is because of me, because it's in the budget, and that's very generous. The reason I'm here today is because when I first ran for office 12 years ago, I had help from Mark McKinney, and it's particularly in his neighborhood. And I remember the day well. It was a Saturday. It was rainy, and he had a golf cart. He took me down. This is a very Republican area. The entire neighborhood, he knew everybody on a first-name basis, and they didn't ask anything. He just said, if you're with Mark, you got our vote. And because of that, I won, and Mark, I am eternally grateful for you. Thank you very much, and it's a pleasure to introduce you today.
Thank you all for coming. On behalf of President Ruggiero and my Rhode Island Senate colleagues, it's a great honor to be here today. Everyone's gone through the litany, but I'll do the same. I want to thank some of the folks who have made this possible today. Obviously, General Treasurer James Diossa for his leadership, the Speaker of the House, who could not have done a better job of making sure this was included in the budget. The Rep. Shaw-Smith and I wanted to get credit for the bill. The fact that it was in the budget was indeed a victory for us. Undue medical debt, and their policy director, Eva Stahl, who's here today, the Economic Progress Institute, and Director Nina Harrison, Troy Peck, Ernie Davis, and the other advocates for this. I also want to thank my colleagues in the Senate who worked so hard on this. Senator Melissa Murray, Senator John Burke, Senator Jake Bissalon, and Leader Ryan Pearson. I'm grateful to the Senate leadership team. They made this possible by their strong support. Look, we know Rhode Island faces many challenges with respect to our healthcare system. And far too often, patients across the state find that essential care is too expensive or too difficult to get. The Senate last year, with their package of healthcare bills, recognized that problem and the seriousness of the situation. And so with that in mind, they introduced a rather wide-ranging slate of legislation. And obviously, in taking on this challenge, this bill, which eventually became a part of the budget, was a part of that effort. And so I was pleased to sponsor the legislation seeking to have the state purchase and retire medical debt. The issue is important because it impacts far too many people, and especially the most vulnerable in our community. No one in the state should be trapped in a spiral of debt and the stress that debt brings, simply because they get sick or their child gets sick. It's a danger for public health. It holds back the economy. It prevents individuals and their families from achieving financial security. I happen to be speaking with Nancy Lavin from the Rhode Island Current prior to this program today, and she asked me whether I had experienced medical debt, and I haven't. I've been fortunate. But I'll tell you what I have experienced, and I'm probably looking at the perfect world. I lived for a year when I was younger in England, and I was surprised to find out that I was covered by the national health system. And I happened to have a fairly serious illness while I was over there, and the care that I received was incredible. And I came away puzzled as to why we, the greatest nation in the world, are among the only developed countries on the planet that fail to have a national health system. So that would be a perfect world, or close to perfect. There's no such thing as perfect, but we could do it if we had the national will. At this point, that's not happening. But in the meantime, we deal with the measures that we can handle, that can control, and this is one of them. So I'm incredibly pleased that the state budget, in the state budget, we were able to create this medical debt relief program that's being announced today. And the approach is really quite simple. We buy medical debt for pennies on the dollar and retire that debt for the people who are in the most need. This has already been utilized successfully in many other places in this country. I am grateful that Rhode Island is taking this important step forward. The program will have an enormous and positive influence. It will make a difference in the lives of many, especially some of our most vulnerable neighbors. I want to thank you again, Treasurer Diossa and Speaker Shikarchi, for making sure this program is ready to go. And I want to thank all of the partners who are here for their continuing work to secure the health of Rhode Islanders. Thank you. And if I could, I'd like to introduce my friend, Rep. Shallcross-Smith.
Thank you for the opportunity today to speak on the House sponsor of the medical debt. I was honored to have been the sponsor to submit medical debt through the House of Representatives. I want to thank the Bradford Group for being an advocate and inviting me into the sponsor of this important legislation last year. It was just last Halloween when I met with Chris and Wally and Ernie Davis from the Leukemia Society here at the State House. They explained to me the depth of medical debt. I was shocked. It was quite an education. I immediately signed on to the bill in this important piece of legislation. No one wants to wake up and realize they're sick or injured. They should and need to be focused on getting better, not the money it's costing. Yet their debt just keeps piling up. Just want to say it's exciting and an honor to be here today and for the first year of the legislation being passed. Prohibits medical debt being reported to credit bureaus. Thus, families with medical debt will no longer have their credit rating ruined. My sincerest thanks to the Speaker of the House, Joe Shikarchi, for his unwavering support, and my colleagues who assisted with getting medical debt changed. Total appreciation to the Treasurer's Office for creating this needed new program. Yet there's more to be done, Speaker. The capping of interest rates and medical debt and preventing people from losing their homes. I can't wait till January to be back with my colleagues and start working with this process. Thank you for this opportunity.
I'd like now to introduce Eva from the Undue Medical Debt. She's the Vice President of Policy and Programs.
Thank you and good morning. It's a joy to be here today on behalf of Undue Medical Debt to celebrate this next step in establishing this program and addressing the issues of medical debt. We are now in our 10th year as a nonprofit, and over that time we've grown, particularly since we started working with government about 2 years ago, and we're really excited to do so. So to date, we've abolished about almost $15 billion worth of medical debt. We're creeping toward helping 9 million individuals and households across the country. So we know that medical debt, and particularly this solution, is not an end solution. It's not policy change, right? So, but as we work toward upstream solutions toward the issue of medical debt, it's a helping hand. And we also hope to, through the stories and through the work that we'll do together, that we'll begin to learn more about the experiences of medical debt that harm so many residents across your state. And what we want to do, too, is galvanize and build momentum toward upstream solutions. So thinking about how do we make healthcare really affordable and accessible for everyone. So as has been mentioned, the model is very simple. We work to buy bundles of medical debt in these portfolios. We pay pennies on the dollar. We help those most in need, so those are individuals and families at 400% of the federal poverty level or below, or if their medical bills are more than 5% of their income. So for residents watching, this is about $100,000 if a household is earning for a family of 3. So this can make a meaningful difference for a range of people struggling with medical debt. We know there are emotional and mental health burdens with medical debt. People tend to hide bills, to isolate themselves, to pretend the problem doesn't exist. It creates a tremendous amount of stress, and people forego and delay care. So the goal with programs like this is to give a helping hand and invite people back into the healthcare system so they'll get the care that they need to become well. Finally, I would like to say that working with local governments since 2022 has been a really exciting initiative for us to build these programs in different states and localities, to increase our program and make sure that it's concentrated in communities, building collective will and knowledge about medical debt and its harm, and hopefully destigmatize medical debt. So thank you for the opportunity to be here today. We're really excited to stand up this program, to work in partnership with the state of Rhode Island and others. And I think it's my privilege to introduce Nina Harrison from Economic Progress Institute.
Thank you and good morning. I am the policy director at the Economic Progress Institute, but I'm also the co-chair of the Protect Our Healthcare Coalition, which was part of one of the many groups lobbying for medical debt relief this last legislative session. So I'm doubly excited to be here on behalf of both EPI and the Protect Our Healthcare Coalition. And I'm excited to celebrate this win. I know we all are working hard for Rhode Islanders all the time, and it's important to celebrate the wins along the way. Many of you may know that medical debt is the #1 cause of personal bankruptcy in the United States. And in a time where our latest report, the 2024 Rhode Island Standard of Need, found that the majority of single Rhode Islanders without children are struggling to meet their basic needs, policies like this, medical debt relief, are so important. Because in the last several years, we've seen not only health care expenses and out-of-pocket health care expenses increase significantly, we've also seen the cost of food and rent increase. And so relief for medical emergencies and medical debt like this is just so important for ensuring that Rhode Islanders, many of which who are already struggling, can continue to meet their basic needs and have economic opportunity. This is not just a financial issue, though. This is also a racial equity issue. Black and Latino Americans and Rhode Islanders disproportionately hold medical debt compared to their white neighbors. And so not only will this policy improve economic opportunity for Rhode Islanders, it will also increase racial equity and improve health outcomes, as some of the previous speakers have mentioned, making it so that people don't have to forego and delay care because they can't afford their medical care. And so I'm so grateful to Speaker Shekarchi, to Treasurer Diossa, and to the Rhode Island General Assembly and to our legislative sponsors for working so hard to patch this much-needed relief for Rhode Islanders. I'd also just like to make a note that you may have heard the phrase being poor is expensive. And that's because it often takes, people have to jump through hoops, maybe to ride public transportation. They don't get to take the most direct route, or they maybe have to go on a payment plan to afford certain things. And navigating medical debt can also be seen as somewhat of a tax on the poor, because it takes hours to figure out what you owe, why, what you can do about it, and what your rights are. And I know people personally, even those on disability right now, who leading into a spinal surgery were receiving medical bills despite being on disability. Having their Medicaid canceled, maybe mistakenly, and not knowing why, but going into this serious surgery, not being able to focus on getting well and having the best outcome, but worried about what other bills might be coming on the other side of it. So again, I'm so grateful that this policy is in place. I look forward to working with you all to do even more for the people of Rhode Island in this coming legislative session, and I thank you for this huge win. I'd also like to introduce Troy Peck, who will share his personal experience with medical debt.
Good morning. I'm an advocate with the Leukemia and Lymphoma Society, and I'm also a father of a 2-time cancer survivor. At age 1, my daughter began a 2.5-year battle with leukemia. Over the course of treatment, Aspen spent over 100 days in the hospital, where she went through 2 rounds of chemotherapy, a blood stem cell transplant, and at 8 months post-transplant, that leukemia returned. We had to look beyond FDA-approved drugs for treatment. Aspen became the 9th child to utilize an investigational drug, which saved her life. All of this comes at a cost. For Aspen, that's over $1 million. Fortunately, Aspen qualified for the Katie Beckett waiver, which in conjunction with our primary insurance alleviated most direct medical costs. However, not all Rhode Islanders are as fortunate and will incur crushing medical debt as they try to stay alive. Today's announcement of the financial assistance program will ensure that other Rhode Islanders do not have to face continued anxiety of medical debt while trying to fight for their life or support their loved ones. I want to thank Treasurer Diossa, Speaker Shekarchi, President Ruggiero for this financial assistance program that will help many Rhode Islanders. I would also like to thank Rep. Shellcross-Smith and Senator Murray for sponsoring this legislation, which prohibit the reporting of medical debt to credit bureaus. I'm looking forward to continuing to advocate next year for more medical debt policy reforms, including interest rate and fee caps on medical debt and the prohibition of wage garnishment and liens due to medical debt. Thank you very much for your time. Back to Treasurer Diossa.
Thank you, Troy. Well, this concludes our event. If you want more information, it's on our website live as of now. But thank you to all of our leaders here, and Undu and Troy, for your story. This program is really going to make a difference in Rhode Islanders. Thank you very much.